Well, welcome back to the podcast. This is the Depths of Healthcare. I'm your host, Ben Iiames, back again. Excited to have all the listeners out there. Really exciting episode today because we are jumping into a new realm that we have not quite explored just yet, exploring the dental world and the specifically of endodontics. We'll call him Dr. Joel is joining us. Joel, why don't you introduce yourself to the audience and then give a little debrief on who you are, how you got where you are right now.
Okay, well, yeah, I'm Joel Fransen. I'm in Richmond, British Columbia, and in Canada, and started out as a dentist many years ago, last century, just in the tip of the last century. Yeah. And worked for a few years, and then wanted always liked endo, which is root canals. And then I had two young kids, and thought, well, now either I go now or it'll be really awkward when the kids are in school.
Good call.
I'll want them to do my homework for me, and not
Yes. I'm
yeah.
sure your wife is a big fan of this decision.
Yeah. Timing.
Yep.
Yeah.
Yeah.
So, yeah, at the time there was only one endo program in Canada that was in Toronto. And in Canada, there's kind of an east-west thing. So when I went out to interview in Toronto, they're like, it starts today at 8 a.m. Are you sure you can make it? I'm like, well, I won't be coming in from Vancouver. It's okay. I show up most times at 8 a.m. So anyway, blah, blah, blah. I ended up getting into Baylor, which is now Texas A&M in Dallas.
Okay.
I did my training down there, which is great. And then came back up here and, opened up an office. Well, I worked as an associate for a couple of years, different offices, got to see different things. And
Yeah.
then,
Kind of learn the ropes.
yeah. And it's really good. You get a good perspective of, what works in some offices, and also the culture of different offices. This is the way Jack's always done it. This is the way Bob's always done it. This is the way Mary's always done it. You're like, there are other ways.
Yeah.
And
Yeah.
what's a big deal in one office isn't even on the radar of another office. You're like, wait a minute, we don't even have to worry about this.
Yep.
Right.
Yep.
And so then I opened up my own and went from there and been there since 2010 with my
Wow.
office. Yeah. And
Okay.
then open up another office, satellite office in Langley, which is a suburb a little further out from Vancouver than I am.
Hmm.
And I also go up to northern British Columbia and the Yukon Territory. So I'm the first ever endodontist in the Yukon Territory.
Wow. That's cool.
There's
That's a
only one
nice
other
market.
now, guy. See, a couple years ago, another guy flies
Do
up
you-
there.
Now, when you started this, when you started your own practice, just you, I'm assuming. And then now that you've had a satellite and then you
Yeah,
got another place you go visit up north,
yeah,
are you asking for help or is it still just you?
yeah. No. I have an associate in my main office in Richmond, and she works about 2 days a week, and she's only been with me just about a year now.
So very fresh. Okay.
Yeah, and she's doing a PhD at UBC. They have an endo program now at the local university, and so she's very academic. So this suits her right down to the ground, and it gives you a new spiel on marketing because you kind of realize the practice is too much about me, and I need to make it more about the place and the competition in Richmond. There's one office and they have like 4 or 5 endodontists in there, and I'm like, I want that. And it was kind of funny when I came back, I wanted to buy that office. And I kicked the tires like 3 times and I was pulling the trigger ready to do it. And the guy would be like, he couldn't turn off the money making machine. I'm like, come on,
Yeah.
hey, do it. Let's do this. And he wouldn't. And then finally he got to the age where he's like, he had to do it. He's like, well, I should run it by my associates first if I go to sell it. I'm like, all right, but I'm number two. I'm number two. Like, if the associates say no, I know a bunch of them are going to say no. And the one guy was a little unsure of, and he bought. But
Oh,
but by then I'd opened my office anyway, right?
okay.
So it was kind of like, well, whatever. I would have had 2 offices, but then I had in my mind's eye it would have worked out anyway because he was living my dream, right? You have an office, and then you got 4 or 5 other guys doing the same thing that you're doing, and you just kind of keep it going. But for years, unless my handpiece is going, I'm not making money.
And that's what I was actually going to probe a little bit into.
Yeah,
Here's the thing. It's like that's the hard part in your industry especially, and you can kind of speak to the listeners about that. If you're not cooking, there's no food being made,
that's right.
right?
Absolutely.
And
Yeah,
so that's a limiting factor, honestly.
yeah.
And so, I mean, does it get more attractive? I mean, you've been doing this for so long now and you've got plenty of experience, at least 15 years in your own practice. Does it get more like, idealistic to say, maybe I need two more people to kind of help me kind of scale back so I can scale forward?
Yes, absolutely. And to be honest, that's a whole new beast to learn all about, right? You spend all
Yeah.
this time and now it's like, how do I get it? So it's more about the office and I get these other people comfortable and good. I got a really good team. And that's one of the reasons why the associate likes it so much because the associate endodontist, my wife's a general dentist
Hmm.
out of university. So the endodontist works in my wife's office and my office.
Wow.
Yeah, but she really likes my office because I got all the toys, and
Yeah.
I got a staff that's just tuned into it. So, it's kind of easy for everything's boom, and she can follow the
And
tide.
yeah, because you realized, I mean, correct me if I'm wrong, but from your experience of seeing other people run their clinics, you bring your own magic and your own special sauce. And you realize it's all about the culture, it's all about the process, and it's all about, nurturing our patients. Right.
Absolutely, yes.
Yeah.
Yeah. Yeah, they're I mean, because I don't really deal with the public, I deal with referring offices. So, as a general dentist, you're dealing with the public. Well, with me, if I annoy a general dentist, that could be a patient or 2 a week,
Hmm.
right? So, keep the dentist happy, you know?
Yeah. What have
And
you,
sometimes the patient will want you to do something that the general dentist doesn't want you to do, and then you're in that ethical dilemma, right? And
yep.
I've been caught sometimes, the patient. So then I have to be very upfront with the dentist. Like, well, at the end of the day, the patient has autonomy, and they wanted me to do this.
Yeah.
And
Yeah.
isn't it
What
fun?
now, what specific things, I mean, just clear it up for the public, like, what the differences are between a general dentist and why they send a patient to you? I mean, other than just, like, root canal surgery, that's a very I know you do more than that.
Not much. It's all about the
There's
canals.
the secret then. There's the secret for all the listeners.
That's right. Endo's a big issue about a little tissue.
Yeah, nicely said. Nicely said.
We're micro neurologists. We just take a little bit of the tissue away.
That's awesome.
Yeah. So basically, yeah, general dentists do about 90 to 95% of all the root canals. And we do the other 5% that are either kind of too grizzly for them, the canal's really tight, or they're really curved, really long. And the patient's
Okay.
got pronounced issues like pain issues or something like that. Or another dentist done the root canal and then it didn't work out. It's become
Mm,
reinfected or it's become infected at this thing. Yeah, so then we do the retreatments.
I see. So you
And
handle
then,
the complex other cases.
oh, yeah, yeah. And a lot of the time it's a tooth, and sometimes it's the tooth carrier.
Well said.
Yeah,
Well
yeah,
said.
yeah, and a lot of the times too, it's just diagnosis. The patient's complaining of pain, and the dentist came in for a hygiene check, and they're like, "Oh, and it's
Mhm.
vague, and it's this," and like, "Oh, go see the other guy."
Yeah.
And
Yeah,
then
yeah,
I
yeah.
dive deep into it and find it. And every now and then you have a case where you're like, you know what? Why don't you come back? In a couple months or sooner if it really acts up. But I actually can't hang my hat on anything. You are experiencing what you're experiencing, but I'm not sure about drilling a tooth is actually going to do it. And
Mm.
we get a lot of atypical facial pain, trigeminal neuralgia, like
Yep.
things like that.
Yeah.
Yeah, so it's kind of interesting.
What are the new kind of, technologies that are coming out kinda in your field that are assisting you in kinda your practice or you're excited about that could be coming
Yeah.
or could be changing?
Cone beam's everything, and we've had them for a few years now, but cone beam CT is just it takes so much of the mystery out of dentistry,
Mm.
like my end of dentistry, endo, right out. You can see the way the bones dropped away from the tooth is highly indicative of a fracture, whereas in a regular 2D X-ray, all that information gets squished, and then you're like, well, is the root cracked? Who knows?
Yeah,
But in the 3D, in the little thin slices, the way the bones dropped away from the root there, it's 90% chance the root's crack. And cracks in teeth are, the Achilles heel for diagnosis. Like, is it cracked? Is it not? Sometimes a lack of healing is how we diagnose a crack.
I see.
If a crack's big enough, everyone and their brother can see it. But if it's a microfracture, it's just a lack of healing sometimes.
Right, and now do you have the cone is the cone beam CT more just specified to the region?
Yes.
Okay.
For
So
guys
it's
who
not
do
a full
implants,
maxillofacial view.
yeah, yeah, we get a panoramic of the jaw to help us locate, but
Okay.
then we just do a small field right there.
Oh, very cool.
And your
Preserve the
physician
radiation.
Yeah, and your physician will get a real kick out of it because as dentists, we're like, "We really don't wanna see much of the skull because if there's anything there, lumpy or bumpy that we don't know,
We're like,
then we could yeah, we might be held liable." So we just have to know, like, that kinda looks normal and, go see the big boys in the big house. That's something
yeah,
odd,
yeah,
right? And so, sometimes when I do my reports, I'm like, I restricted my review to these teeth. I mean, I do have a look at other things there,
yeah.
but, and I think a lot of dentists and probably I'm not sure how this translates in the physician field, but a lot of dentists get scared about those machines. It's like once you get a few centimeters past the teeth, we start to drop off in our knowledge, right? And you're like, "Oh."
Totally. I mean that's kind of where every specialty kind of runs into the eerie spots.
Yeah.
Well, when you're so specialized, then once you start tiptoeing outside of your lines, you get terrified,
Yeah.
right? And you're like, wait a second, I don't know anything about that, and I can't know anything about that. Whereas
Yeah.
in my field, I have to know a lot, or I have to know a little bit about everything, and there's nothing that I cannot triage. So the curse of the ER is the what's called the incidental finding.
Mhm.
But they come in with belly pain, and then you find, I mean, the worst stuff is you find cancer, and you're like, oh, that one's supposed to be there, or scan the brain because they fell and bonked their head, and then you find an brain mass, and you're like, okay, well, here we go.
Yeah. Yeah.
You know, there's no outside the realm. What are some of the biggest lessons, I guess, that you've learned in these 15 years of kind of running your own gig and calling the
Yeah.
shots and developing the culture and seeing what the best business plans are looking like for you?
Yeah, have a strong team.
Yeah,
I tell my team I want to do what I'm legally obliged to do and nothing else. And they kind of
yeah,
like that because I have very empowered staff.
yeah,
And that gives them a lot of job satisfaction.
right,
If you're in an office and you're getting hammered a lot, wage, it's probably not because of the wage. That's just something that they're grabbing onto because they're unhappy in the work environment. I mean, sure, everyone would like more money, but if someone keeps harping on about money, it's like it's a symptom.
something's deeper.
Yeah, something's deeper, right? And because the good team, they look forward to going to work because they're kind of masters their own domain. They can control this, they control that. Like I talk to my staff, like someone's got to be on the floor, not breathing for me to go in the sterilization room. Like that's your room. You guys do it, and I'm not going to micromanage you. And I think that's where a lot of dentists fall into is they micromanage it. It's like they know the
Right,
goals, and I'm happy for however they want to get there.
right,
And
right.
that's huge. And I know a colleague, and he actually ended up selling his practice because he micromanaged everything to the nth
Mm,
degree. And I was like, hire an accountant, hire an IT guy, you
yeah,
know.
delegate as much as you can.
Yeah, yeah,
Well, I mean, because I feel like that's the recipe for burnout. And
it
correct me if I'm
is.
wrong in that, but with the different business owners that I speak with, it's like if you try and do everything, I mean, your next vacation is when you retire, but you retire sooner than expected because you're so overwhelmed with everything.
Oh yeah, 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 yeah. No, absolutely. You just, my niche is this, and I'm here to fix the teeth, and other things go down. I mean, I can do a little bit, but yeah, no, they're coming to me for my expert opinion, so I respect professional boundaries and other experts.
Yeah.
You're the IT guy. I know how to turn the computer on. I know my program. And that's about it.
Did you like my IT fix for the listeners?
You were
I was
on it. It was so
I
good.
I resolved this massive IT problem we had before jumping on the recording. Sometimes it's all it takes. Turn it off and turn it on.
Yeah, yeah. Stupid me. I was like, oh, I'll hook up this fancy new mic, and sure enough,
It happens. It happens to the best of us. So tell me about like some of the biggest hurdles that you have seen and have had to overcome or are still attempting to, like still trying to actively problem solve with your practice.
yeah, it's marketing. Getting the dentist to send to you. Like I have my loyal following that are loyal with me, and then kind of breaking down the doors to getting someone new to do it,
Right.
like
Because there's
and
always new dentists kind of coming in.
yeah, yeah, and just, trying to keep it fresh and last time, I don't know why, but it's been 3, 4 years. And that's a really awkward conversation. Like, did I do something wrong? Did I annoy you? Like,
Yeah.
like, come
Let's just
on.
go get a drink and like hash this out.
Yeah, 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 yeah. I won't do the final filling. I'll just put a temporary filling in there, and then you can do the final filling, like, whatever it is. And that's tough. And psychologically, it's tough too
Sure.
to make that call and,
Yeah.
let it out. Like, I just noticed it up in my northern practice. Like, normally we're swamped, and I got a trip in December, and it's like we've got like minimal referrals. So like, I asked my team, like, can you phone their offices? Did
What's
something
going
up?
on? Yeah.
Yeah, and they're like, they're all slow. And they're like,
Yeah.
it's just blah. And so you're like, oh, okay. Well, that's fine then. Like, I don't need to have a personality adjustment or learn how to get to the end of the canals anymore. You guys are happy with that. Okay. Then that's okay.
Yeah.
We're
Yeah.
all in this together. Yeah.
Yeah. If
Yeah.
it's slow across the board, it's slow across the board for you as
Yeah.
well. But it's
Yeah.
also, I mean, marketing is one of the hardest things, I think. A lot of directors and CEOs that I kind of talk to with their own small business in the healthcare field, it's like I wasn't trained on, P&Ls. I wasn't trained on, how to market myself. I'm not marketable. I just have marketable skills.
Yeah.
Right.
Yeah.
Or you think you're very marketable and you try to market yourself, but it's hard to sell. I mean, it's hard to like, where do I find people? Like, how do I get my name out there? How do I, foster these good relationships with, patients? I mean, people think it used to be, I mean, in the very, very small towns, I feel like it's organic or bust, right?
Yeah.
It's word of mouth. It's my
Yeah.
family member, my cousin, my coworker. But, when you get into the bigger cities, like, it's harder to build that following. It's hard to find the people that actually need the help.
Yes. Yeah. I know it is. It is. There's a lot of other people out there that they're spoiled for choice. And so in some regards, they're not even looking for input from other people. They're like, oh, I can just Google it and find some guy. Whereas in smaller towns, they'll be like, well, there's two or three of them. Well, I'll go ask my neighbor. There's
Right.
a good one.
Right.
And big city is like, no, I'll just do it myself.
Yeah. And then who's ever at the top of the Google search wins.
Yeah, yeah, yeah. And so that's tough. For a number of years, I did a newsletter, and that was really good.
Really?
Yeah, I did it for like 10 years, and honestly, I was just one page, right? Because I remember being a general dentist, and I would get newsletters, and these specialists would buy them from newsletters company, and it'd be 3, 4 pages. My tolerance is like one page, right? Short and sweet and to the
Like a
point.
resume.
Yeah, 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 like come on,
Yeah.
yeah,
Hit the hot points.
yeah, like let's. Well, I don't want to know about high school.
I don't care about your honor society in
Yeah,
high school.
yeah, yeah. Number one dog walker. Yeah,
Congratulations.
yeah, and so it'd be really good. I had this one page, and honestly, it took like 6, 7 hours because I really tried to make it efficient and good and all that. And it was a huge marketing thing for me, and it was great. And it was kind of funny because my wife would go to dental conferences, and she goes, "Do you know Dr. Smith?" And I'm like, "No, no." "Oh, you and him are buddies." I'm like, "Who is
Wow.
this guy?"
Yeah.
Well, because they would feel a personal connection with me as though I was actually really talking to him. Like, "He's your buddy." I'm like, "I have no idea who you're talking about."
All because of this newsletter.
Yeah, yeah, yeah. Some guys would keep them, and when I say guys, I mean women and guys. Keep them and catalog them, and then I would even get, like, some offices saying, "He only sent us 1, but we have 2 dentists, and they both want." And I do a mail out, and I do an electronic version. And it
Right.
was really, really good, and it was awesome, and you tackle specific topics, when that root canal thing came out on Netflix,
Yeah.
root canals give you cancer and all that. Well,
Sure.
so I tackled that, and it was great. And I tackled, radiation phobia.
Yeah. Yeah.
It's a huge thing in dentistry, and I'm not sure it's so much in medicine. I mean, it's just hilarious. Patient will come in and they're like, "I don't want a PA, a little periapical radiograph of their tooth." I'm like, "Okay, well, how about a cone beam?" "Yeah, no problem." And you're like,
There's
"No."
so much more
Well, I
concentrated
know, it's like,
radiation.
I don't like the alcohol in a Belgian chocolate, but, give me that shot of whiskey. You're like,
Give
"Are
me
you
that
kidding
100
me?"
proof.
Yeah, like, "Okay." Because they're just focused on the dental x-rays. And so just different things like that. And it was really, really good. And it would be wonderful if I did it again, but then your life gets busy and a lot of, a
Yeah.
big thing happened in our life, so that I stopped it just because I had to focus
Focus.
on other things. and then it'd be great to get back. But and honestly, it was like very, very specific, very, very me. I would collect information and I'd try to boil it down like a Cole's note on this one subject. So the dentist just loved it because it's like, whoa, he's covered everything in like one page.
Love it.
Yeah, yeah. And it was before AI, I use Grammarly to help with my
Yeah,
English,
yeah, yeah. Yeah,
because
yeah.
you're just like, I gotta cut the sentence down, I gotta be way more efficient. Like, it's amazing when you write, you're so inefficient. Your sentences are so long, so this. So I would go
Yeah.
through like 8 drafts. You're like,
Yep. Yep.
yeah.
And
And
then
it
if
really
you
gave
can
you
now you can, I mean, even that's transformed into using AI and you're like, this is what I need to write in
yeah.
my, medical jargon or combination of medical versus other things. And then you're like, okay, now make this concise or make this professional. And you're like, whoa, that's amazing. Like that's way more diced and looks very nice.
Yeah. Yeah. No, and they'll use a turn of phrase and they'll put a spin on it. You're like, oh, this is, taking that boring sentence, made it much more enticing and interesting. And the information is much more palatable to digest.
Yeah.
Yeah.
You
Yeah.
basically had hot takes for dentists.
Yes. There we go.
There you go. And were you sending out Canada and US
No, no, just the local area, just
or
here.
just the locals?
Yeah.
Nice.
Yeah, yeah. I mean, I guess maybe some people that I managed to pick up from my emails, some Americans might have got my spam.
Maybe some Dallas.
Oh, yeah, yeah, yeah. Some guys down there got it because
Yeah.
we use a different tooth numbering system. I remember one guy's like,
There you
"What the
go.
hell's a 1 4?" Like, "Okay, that's your,
All right, cowboy.
yeah, yeah, yeah. You got your
Oh
5."
man. I mean,
Yeah.
that's cool. I think it's fun to like try different things. That's the first, you're the first one that I've heard using an actual like kind of hot take newsletter
Mhm.
for marketing purposes because most
Yeah.
people are using the tried and true channels of we're doing ad campaigns, we're running content on social media channels, we're doing this and that and this and that, but it's so much different in the medical field. That's not how we
Mhm.
reach people, right?
Yeah.
What are you seeing development kinda in other ways that other offices are doing kinda around you that you're
Well,
interested in?
yeah, yeah, like, Instagram guys will post cases on that, and really, really interesting cases. I mean, for the specialists, a little bit different. For the general dentist, I mean, they're almost like comedy sketches on Instagram. I mean, there's some pretty clever ones, and
Yeah,
I can see the public being really interested. But I'm kinda thinking between you and me, they're getting a lot of dental views. It's not, like, as opposed to public views.
right,
But for specialists, yeah, you get the dental guys on there and it can really make an impact. And in some regards too, if everyone's doing the Instagram things, and that's great, and you can do it, I'm almost thinking now the paper newsletter and the email will have more of an impact because it's the one coming across your desk. Whereas in the 20 years ago, you were getting mail like it was going out of style, and
right,
and now you almost get nothing.
right, and you're like, the mail that you do get, you're throwing most of it out anyways.
Yeah, it's
Junk.
a marketing tip I can tell anyone: don't do this. This is really bad.
There we
Don't
go.
put private and confidential on anything that's marketing. You will not get the response that you want from a dentist because they're thinking it's from the college, or a lawyer or
Yep.
some crap. And you're like, I know one dentist, his staff called him and it was his day off, and it's like this letter, and it didn't really, the return address didn't ring any bells. It's confidential. So the actual guy drove into his office to check it out. He's all stressed out,
Oh,
and
his
then
heart
it's
rate was jacked up, his blood pressure's through the roof.
I mean, is that concern didn't have the receptionist even open and go, well, what is it, right? So he comes in and it's like from a specialist who's like trolling for business, and he's like, "Whoa, that's a poor landing. No way, Jose."
Yep, and then you make it on the no-fly zone.
Yeah, 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 yeah. You made an impact, but not the one you want.
Not the one you want. I mean, that can be the case with marketing, right?
Oh yeah,
It
yeah.
flops or it really hits.
And then my wife had one where a news specialist came into town and he phoned their office and said, I'd like 15 minutes of Dr. Fransen's time. Um, and so can we book a time to have this phone meeting? So I said, oh crap, it's about some patient who's thought my treatment was crap and I was going to a specialist and, just getting all stressed. And it was a marketing one. And she's like, "Oh my God, like, are you kidding me? I hate you right now."
Do you know how many sleepless nights I had in
Yeah,
advance of
yeah,
this
yeah.
meeting?
Like the relief that it's not bad isn't kind of killing the fact that I had hours of bad thoughts about that.
Right.
Yeah. So be upfront about it. Expect some of if you are sending stuff mail, it's gonna get binned. But then summer goes, I think mail now, physical mail can have a bigger impact because everything's gone so digital.
You heard it here first. Dr. Franzen says paper mail is making a comeback circa
Yeah.
2025.
Well, it's exclusive, right?
Right. Right.
Right. So there's your niche.
Yeah, there you go. And then you
Yeah.
can feel that because everyone's moved away from it, now it's moving back and we're
Yeah.
swimming
Yeah.
back towards it.
Yeah. Yeah. Yeah.
Oh,
It's
it could be fun.
yeah.
So
Yeah.
what are your talk overall. I mean, we've kind of ranged our conversation around all over the place, but what do you think about dreams for the next, I don't know, 5 years, 10-year plan of your practice, of you practicing, dreams and goals of kind of what you see coming down the pipeline?
Yeah, multi, endodontist office, like, having my associate work more or have another associate there, um, and turning my office into it's not just about me, transitioning into it's more about the office.
Right, it's more about the culture and everything that you've built.
Yeah, I got a great team, and that's the other thing too is then to have another person join the team, so it's kind of interesting, like, we have a new employee coming into the office, like, I almost don't even need to interview them.
Wow.
Because if my staff don't like them, I don't like them, right?
Right, right.
They can
That's
hide a
how much you
million si
trust them.
yeah, and they can hide a million sins from me, but all the other staff members are gonna see is like, "Actually, you guys let's just do a working interview because everyone can so many people are good at interviewing nowadays
Mhm.
that it's almost like everyone's kinda pretty good.
Yeah,
So, come on in for a working interview, and then let's actually see if you're a team player. Let's actually see if you can, learn things quickly." And
yeah.
we
How
find
you
that
interact also under pressure.
Oh, yeah. Yeah, yeah. Yeah, like, that was actually one of the things we did in the interview. This is back when I started. I got all these tips from these guys. It was an endo chat, and they're like, "Give 'em a math test that they can't finish in time just to see how they react under
Oh
stress."
my
Like, it's, like,
gosh, that's
impossible.
brutal.
Just see if they absolutely lose the plot, and like, "Okay."
Or if
And
they
some
just
of them
say
just laughed and went,
or
"Oh
they
my
just say, "Well,
this
I
is
can't do it.
ridiculous." Yeah, yeah, and you're like
Sorry."
yeah. And actually, one of the best things when I was interviewing my receptionist who's been with me 15 years. Like I started off, I went through like 3 at the beginning, and then I got the good one.
Yeah,
And one of the things that really warmed my heart to her is like she was telling me about her job history, and she worked for this one specialist, and she goes, "It was just a mill. People were lined outside in the hallway, and it just no one was really you weren't dealing with people as were human. It was just like, yep, 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 whatever.
yeah, cattle mill.
In and out, in and out. Thank you very much." And so she went from that to a general dentist's office, and he micromanaged everything, and he was just negative, negative, negative. So then she comes to interviews with me and she goes, "I wish I'd never left that first place because even though it was a bit of a mill, the guy had more of a personality and this and the other."
Right.
And what a wonderfully honest answer because you would expect the average person would be like, "No, every step was forward." But she
Right.
recognized she'd made a mistake and you can't always tell you're going to make a mistake, right? That general dentist office, it could have been fantastic. You never know.
Everything can, you never know until you actually get into it, right? You gotta experience it. You gotta go through bad situations to realize that they're not good.
Yeah. So I totally appreciate it. I'm like, oh my God, that's such an honest answer. I think this person's a straight shooter and this and the other. And it's worked out that way.
I think what I've realized in these different medical practices to help them succeed, and I hope this continues for yours, the better people that you hire and the better team that you have, like the more close knit, the more you can tolerate all the chaos that comes with just
But yeah.
practicing medicine and just being in the world that we are today.
Yeah. If the staff know you got their back and then it just makes dealing with like patient issues that are just crazy tolerable. Right. And it's like, don't worry, we'll talk about this after they're gone. And I
Yeah.
said to my staffs a couple times that, if I say something to a patient that upsets you, that it makes it looks like I'm stabbing you in the back, it's probably just because I think the person needs to hear that lie. Like sometimes they just need to hear that lie and
And then you're
and
like,
we'll
"Don't
talk
worry, I
later.
still have your back.
Yeah, 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 yeah. But
You're not
I
completely
mean, I
you
never
weren't
really
completely under the bus."
yeah, 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 yeah. And it's just like sometimes, a complainer just needs to hear that the complaint's been heard.
Yep.
And
Yep.
like, yeah, 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 I get you. And afterwards, I'm like, to my receptionist, like, I know you always tell them the booking, but then this person's like, she didn't tell me. I'm like, oh yeah, okay, well, we'll look into that. Yeah, we'll
It's
laugh
the
about it later. It's
yeah. Yeah.
translation to that because
Because
I know.
that's what it's all about. It's building that good trust with each other where you can say, "Hey, that's your area. Like, I know that you have that dialed in.
Yeah,
If you need help, you'll come to me." But
yeah,
for then, are we good? Okay, good.
yeah, yeah,
I mean,
yeah, no,
that's what I mean, our job, I mean, I work at a level 2 trauma center and it's like it's chaos. I mean, we're the busiest hospital and the only hospital in kind of rural western United States, so we have 250 miles without a trauma center in every direction. And so we take care of all the transfers, we get everybody who's kind of the end of the line. We are the sending center. And so if you don't have a good team, if I can't trust my nurses, if I can't trust my techs and all the other providers that I work with, then it's going to fall apart. But everyone's got each other's back. We look at each other some days and you just go, man, is your day sucking? Yeah. Is your day sucking? Yeah. Okay. Well, at least we're together.
yeah, yeah, yeah,
You
yeah.
know?
No, it makes all the difference in the world. Um,
Yeah.
when you
So,
kind of go in and there's no knives out for you
yep.
except for maybe the patient. You're like, well, I can take that one.
You can deal with that. You can deal with that. Yep. Your appointment's over. Okay. See ya.
Yeah, yeah, yeah. I
You
gotta
don't,
work with her all day, so if we're fighting, it's gonna be
that's an
miserable.
issue. Yep. Yep. That's a good point. You only have your hour.
Yeah, 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 yeah. So sometimes I joke with a patient. I'll walk in and they've been with an assistant, and they're like, I'm really scared and stressed. I'm like, hey, don't worry, Marie does that to me all the time. I know exactly where you're coming from. She's very intimidating. I mean, she's 5 foot nothing, sweet as
Sure.
pie.
Sure.
Break the ice.
That's perfect for it.
Yeah. And
But,
and I mentioned with your trauma, I mean, sometimes it's the patient, but I can imagine you just sometimes have a gong show around the patient of everyone, a histrionics, like, oh my God, this person's hurt and you need to take care of this person for me. And you're like, well, I do if you would shut up and let me do what I gotta do.
well, yeah, I mean, honestly, it's more really the more non-urgent things that kinda draw
Mhm.
you away from the true emergencies, and that's what I mean, this might be oversharing for the listeners, but it's just like when you've got a drunk and aggressive guy who's not really medically complex, but just being an idiot and, you know, threatening and assaulting staff. And if the cops are there and they still don't have your back and are not protecting you, think about the actual sick people who you're not able to service and not able to help.
Yeah.
And so it just drains that meter and you're having to play like daddy daycare for these kind of just people making poor decisions. And then you have to say, "Oh, I'm sorry, you have legitimate belly pain and you have, like a septic joint or something like that." Something true emergency needs to be there. I'm sorry, I had to deal with this guy who's trying to spit on my staff. What are you
Yeah.
going to do? There's my venting session. Thanks for opening that up for me, Joel.
It warms my heart. Some of those problems are like way beyond what I deal with. But yeah, so we would deal with it and you come out smiling because you got a good team. But yeah, when you're in the
But that's what it's
trenches.
all about. Here, that we landed it. We landed it to say it's all about the good team that backs you up. And my nursing staff, I will lay my, put
Yeah,
my foot on the line for them. And like sometimes you just have to step in and say, "Hey guys, I got this." Like
yeah.
it's not your fault. But what else? So Joel, kind of transitioning, where can people find you? I mean, where are people like looking for you? And I mean, this is not the marketing ploy. I don't have a following of 10 billion people, but where can
Well, I'm
people
on
reach out
LinkedIn.
if they use
Right?
this? Where can people reach out? I mean, where can they find you? Like
Yeah,
what?
yeah. I'm on LinkedIn, and that's actually one thing I was gonna say is, LinkedIn. I get it flooded with messages in, and usually from, AI, like use AI or
Right,
this and the other. And
right.
honestly, yours stood out because you actually mentioned a few personal things. Like it was like, well, this guy actually read my profile. You know what I mean? And it makes all the difference. But yeah, so if you send me a LinkedIn message and I didn't respond, it's because I got mixed in
Yeah.
the the
Mixed with the
melee.
AI reach outs.
Yeah, yeah, yeah. And that I'm on Instagram and Facebook and TikTok. I try to do funny dental videos, like of the cases and such things like that. And
I love it. I
yeah,
love it.
yeah,
Well, maybe
yeah.
we can increase that following. I'm excited to follow up in the next. Maybe we'll rehash it in 12 months, and you'll have two more people on board, and you're like, "Hey, I'm doing it.
That's right. The empire is growing.
The empire is growing, and I'm actually stepping back."
Yeah. Yeah. I'd love to talk more endo and perhaps do be less in the trenches. Yeah, absolutely.
Exactly, exactly. Well, Joel, thanks for joining us today. Really
Yeah.
appreciate your time. I mean, I know it was your time is very valuable, so I really appreciate you sparing even just the hour that we had.
Thank you, man. And thanks for reaching out. And I really enjoy this. And yeah, growing up when I was young, I wanted to go into the medical field.
You
And
did.
I did occupational therapy before I did dentistry.
You've
And
done
then
everything, Joel.
I lost my way. I went into dentistry. So I apologize to all the medical professionals out there.
Joel, what you do, I would not want to do. So I
Yeah.
I am glad there are more of you out there, you know.
Absolutely, my friend. Yeah.
But thanks for the time. We'll sign off, and that's another episode completed. Thanks, Joel.
All right. Thanks so much, man.
Yep.